Perfect Balance Healthcare presents Lick, Stick, and More with your host, Dr. Nandita Koodie. Join me to explore the minds of thought leaders as they share golden nuggets on the impact of faith integration in practice, professional development tips, and innovative solutions to bring you beyond ordinary healthcare. Thank you for coming in to join me for another episode with me, your host, Dr. Nandita Koodie. I have with me today doctor, friend, and consultant and partner, Dr. Zahid Sheikh. Dr. Zahid Sheikh, MD, is a family, geriatric, and emergency medicine doctor with over 30 years of experience in urgent care, primary care, and walk-in clinics in management, project development, and marketing, as well as consultant in construction of outpatient clinics as well. You know, one thing I wanted to pick your brain on that I was really curious about as I was coming out of school and starting on my career into entrepreneurship, I feel like there is more openness and acceptance of entrepreneurship in your profession than mine at the education level. I feel like the idea of opening your own practice and starting what doesn't exist and creating your own path is something that is heavily discussed at the educational level and in your training. How true is that? And have you seen, and I just say this from my personal experience, you know, and having been and explored and spoken to different pharmacy students from different schools, I feel like now there's been, because of COVID and some of the other challenges that we face as a profession, there's a little bit more acceptance to entrepreneurship out of necessity. But I don't feel like it's something that was openly discussed as an avenue at the point of training. Is that true, or am I wrong there? Or do you feel like it's something that was discussed and actually offered support and resources at your training level?
I think before, what it was is never really discussed. It was kind of just, hey, you finish medical school, you open up your clinic, put your name up, and you're done, and you start practice. It doesn't
it's just the culture, right? It's like
culture,
like expected almost, right?
But now it's changed. The paradigm, the physician. There are now more physicians who are employed with healthcare systems compared to independent physicians. The paradigm is totally shifting in medicine. So more and more people are finding it hard to set up their own practice. And there's pros and cons, because when you come out of medical school, you've got a $300,000 debt. If you open up your practice, it's going to be a year before you make any money. But now you got a paid job, you just join a big hospital and that's it. But when you join the hospital system or employed, remember, you've given up your freedom.
I wanted to ask you, from your experience, being a part of a group practice or being an independent physician, where's the difference in the freedoms there? And what do you feel like patients really want with regard to the type of care that they seek out? What are they looking for?
Patients really want to be taken care of. Now, do they care whether it's a big institution that's owned by a big corporation or an independent physician? They really are saying, hey, who's going to take good care of me? They're not really looking if it's independent or a big name institution. But for physicians, the independence is basically, it's a double-edged sword. Because if you have a lot of debts, you're going to go someplace you work. But then you have to follow by their rules and their paradigms. And that means your freedom is kind of challenged if you want to do something and demand something. When you're on your own, you can set things yourself, work things the way you like them, but deliver proper care within the paradigm of the protocols that are put there.
I feel like so many patients just go wherever their insurance.
That's the other thing.
They should go, right?
Well, you got to understand that insurance are the masters, so they're the ones who dictate. And I'll be upfront with you. You cannot, you know, if someone likes you, but you don't take the insurance, they have to pay cash, but they'll come to me because the insurance dictates they come to me.
Have you found success with any cash-based services?
That is coming up now. If you look at quite a lot of people in a lot of states are doing what we call concierge medicine.
That's right, DPC.
Yeah. It's coming up. It's coming up. Direct patient care, and there are different models, and people pay a different amount of money. And monthly, what we call subscription. Well, you pay for subscription to Netflix or Prime or anything. Same thing, you're paying a subscription, but you have a physician that's 24/7. and it makes a big difference.
Yeah, no. Another thing I wanted to point out for pharmacists is seeing is believing. For a lot of us, we want evidence for everything, every decision we make, and everything we do. Observe there is a pharmacist and a physician on your screen together. It exists. It can happen. And I feel like a lot of pharmacists feel like that is not possible, that you guys are on some sort of a pedestal where there's no way we can even create a relationship with you guys because we could barely get through to you at the point of clarification for a prescription when we're running the pharmacy and we're trying to get something to make sure it's right for the patient. We end up having to use the nurse or the front desk girl as a liaison to try to get through. And then we may not even get to talk to you actually to get that clarification unless we ask for you specifically.
And that thing is going back to the basics of education, which I have actually, with the free clinic, I've been running in Detroit, was basically we integrate, and I say it to the medical students, take the pharmacist with you in the room, because that is your future partner. Because it's very important. Now, us, we write scripts, and quite often we can overlook something. And that's where we need to have a pharmacist. Now, the collaboration between physician and pharmacist is very important for patient care. If I want to practice good care for my patient, I've got to have you on my team. If I ignore you, I'm setting myself up for a disaster and a clinical bad outcome, and I'm going to harm the patient. This has to be very important. And I keep telling the physicians, medical students, your pharmacist is your protection from a bad outcome. The reason they call you is because they're worried. It's not because they're challenging what I'm doing. They see something which I didn't see in the office, or they saw someone else and got a prescription which wasn't in our EMR. EMRs don't talk. They don't integrate. So there is so much disconnect. And if a person is using you as their pharmacist, they're going to 10 different doctors, but you know what's going on better than any of the 10 guys. So there has to be a two-way street. And it's very important for physicians who are listening. Very important to get to know your local pharmacist, work with them, maybe take them out for lunch, and then say, hey, you know what, you're my buddy, or invite them to the office. Collaboration is very important.
I just want pharmacists that are watching to know that physicians are accessible and that collaborating with them is much easier than you think it is and much more possible than you think it is. And it's so important that you do it for the sake of creating health hubs in your communities where we know what's going on with our patients and there's transparency there and there's a real relationship. And it's not just saying, okay, well, 30% of my prescriptions come from this physician and that's why I know them. No, I know them because we have a real relationship and they know that I can call me and I'm not going to be bothered by that and vice versa. And that, we can actually work together to support our patients outside of our brick and mortars and to actually be there to monitor and support them through services like CCM, and that there are consultants, pharmacy consultants like myself, who are finding success in partnering with companies such as Hillside to do CCM related services. So it does exist and it is possible. And Dr. Sheikh and I have a wonderful relationship that is continuing to grow day by day. We keep up with each other regularly and we are actually partnering in different business endeavors. So it's really fun and an exciting relationship to have. And he's one of many physicians that I collaborate with to really help bring patient care to the forefront of what we're doing. Well, one of the things I've been seeing is that a lot of clinics are looking to incorporate pharmacy services in-house as opposed to just out, referring everything out. They're looking to actually build pharmacies in their clinics. Is that something that you're seeing as well? Because I know you're involved a lot in consulting for construction of clinics as well. Have you seen that model being presented from some of your clients as well?
It depends where they are. Sometimes there are places in small towns, there's a pharmacy, then you have primary care right beside it, so it makes it easy. And sometimes you got big cities, well, there's a pharmacist down the road, independent, so then it's not worthwhile doing that. It varies, but it depends on the market, what the needs of the community are.
Yeah, how likely is it for a physician to contract a pharmacy to do CCM services?
Well, obviously, the pharmacist is very important because, again, one of the biggest scores in MIPS, medication reconciliation. So that's where the pharmacist comes in, because in our Hillside CCM, you got to understand, when we call the patient, then we find out some issues. then the pharmacist jumps in and looks at that from his or her perspective and sees that there is a problem. So pharmacist collaboration is very important.
The biggest question is, though, how do you initiate a relationship with a clinic? What is the best way for us to connect with physicians, in your opinion? Is there like a magical mecca of physicians that happens annually that we might be able to join in on? Or is there like a place that you guys play that we can come and play to and say hi and see what's up?
I think basically the most important thing is if you're my neighborhood pharmacist, say, hey, Dr. Sheikh, I'm your neighborhood pharmacist. These are the services we provide. And we'd like to work with you so that your patients get better care. And the physician says, okay, let's go and deal with my community pharmacists, because community pharmacists are more engaged with their patient care compared to big name companies. When corporate America comes, they come with a certain thing. But when you're a community pharmacist, independent pharmacist, you're more engaged in your patient care. The loyalty to you is much better as an independent pharmacist compared to anyone else. And the way you're more approachable. And as a physician, if you have a partner like that, then you know your patient's going to get better care.
I wanted to ask you, where do you see the future of healthcare going? Is there really a bigger push towards preventative care services, or are we still stuck on focusing on the elderly population right now?
I think the preventative care is coming in. It is coming in. We were a bit late, but it's coming in. Because what happens is, nutrition, exercise, these things are being pushed everywhere, types of food. So that preventative medicine is coming in aggressively. And we are starting to be more proactive than we were before.
This is my favorite Scotsman.
Well, I grew up in Scotland, Glasgow, where you had the Glasgow coma scale.
Why are you here? Why did you come to
America gave me good food. It was the burgers that were better here. And I think moonshine was better in Kentucky.
Did you live in Kentucky?
No, I've been there, but remember, Kentucky is just like Scotland, beautiful and green.
Where are you right now, Michigan or Florida?
I'm in Michigan.
You're in Michigan. This man gets around, by the way. I'm jealous.
Yeah, I basically like to travel. I think what it is, where there's a need for delivering or setting up a better clinic or to set up a practice, then I go consult and help people build up practices and make sure that we have good quality care, because right now a lot of doctors are tired of being data entry clerks, and I'm trying to take that away so that we are talking to each other rather than me doing this on a computer. And I think as a physician, I'm tired of doing that. I want to see my patient, and it's very important. And then we have to start changing that, and that's where I'm kind of helping practices to set up like remote things so they can just look at the patient and all the data entry work is done somewhere else.
I'm not buying it. You're escaping your responsibilities, and that's why you travel so much.
Oh, that's true. That's true. But I have to tell everyone, how to get it going. You got to take care of patients.
I know, Dr. Sheikh. I know the truth. Thank you so much for your time and for spending this evening with me. And I'm excited to chat with you again soon on some of the other stuff that we're doing behind the scenes. But I wish you a blessed rest of your day and weekend, and I will talk to you again soon.
Take care. Thank you very much.
My pleasure.
Good night.
Thanks, guys, for tuning in. If you enjoyed this episode, please subscribe on YouTube, Spotify, LinkedIn, all the other social media sites. If you want to get in touch with me, learn how to collaborate with physicians and the benefits of it, feel free to email me, n.koodie@pbh.life, or reach out to me on any of these social media website platforms, and I'll be happy to share with you how. Take care. God bless. Thank you for listening to this episode of Lick, Stick, and More. Subscribe and follow us on YouTube and all the social media sites at Perfect Balance Healthcare, or visit us anytime at pbh.life.